Hello friends, today we'll get to know about difference between cardiac arrest and heart attack. Generally people consider them as same, but they are not same. They differ in their uh, cardiac arrest occurs when the heart malfunctions and stops beating unexpectedly. That is, cardiac arrest is triggered by an electrical malfunction in the heart that causes irregular heartbeat, that is arrhythmia, and with its pumping action disrupted, the heart cannot pump blood to the brain, lungs, and the organs. That is, the cardiac arrest is an electrical problem. And in difference with that, the heart attack occurs when the blood flow to the heart is blocked. That is, a blocked artery prevents oxygen rich blood from reaching to the section of heart. If the blocked artery is not reopened or quickly, the part of the heart normally nourished by that artery begins to die. That is, heart attack is a circulation problem. With this, this means that cardiac arrest is an electrical problem and heart attack is an circulation problem. In cardiac arrest, seconds later, a person becomes unresponsive, that is unconscious and is not breathing and is only gasping for the breath. Death occurs quickly if the person does not receive immediate CPR. In cardiac arrest, a person's chance of surviving in cardiac arrest can be doubled or tripled if the CPR is provided immediately. First, we have to call the local emergency number and start CPR right away. Then an automated external fibrillator, that is AED, if AED is available, automated external defibrillator, then it has to use as soon as possible. If the two people are available to help, then one should begin CPR immediately, and while the other calls the local emergency number and finds AED, that is automated external defibrillator. And there is a 10% drop in survival each minute, which is why CPR is so important. The emergency medical staff are also trained to revive someone whose heart has stopped. In heart attack, symptoms of heart attack may be immediate and may include intense discomfort in the chest or other areas of the upper body, shortness of breath, cold sweats, and or nausea, vomiting. More often, though, the symptoms start slowly and persist for hours, days, or weeks before a heart attack. Unlike with cardiac arrest, the heart usually does not stop beating during heart attack. The longer the person goes without treatment, the greater is the damage. The heart attack symptoms in women can be different than men. That is, shortness in regard of shortness of breath, nausea, vomiting, back or jaw pain. Heart attack, we had to uh, call local emergency number to get the emergency room right away. Emergency medical services, then start the treatment right. The patients with heart attack should be transferred to the hospital as soon as possible for the further treatments. Generally, most heart attacks do not lead to cardiac arrest, but when the cardiac arrest occurs, heart attack is a common cause, and other conditions may also disrupt heart rhythms and lead to cardiac arrest. Cardiac arrest is a leading cause of death. Cardiac arrest affects thousands of people annually, with all about 75% of them occurring in the home. Fast action can save lives. That is, with this, sudden cardiac arrest means electrical signals to the heart malfunctions. Heart does not beat properly, stopping the flow of the blood to the vital organs. There is no warning, and the first sign of a problem is passing out and becoming unconscious. Heart rhythm is interrupted or stops pumping blood around the body. Causality stops breathing and becomes unconscious. Seconds to become unconscious, death within the minutes if no treatment is given. So immediately has to given CPR, and if a defibrillator is if available. And the heart attack, that means arteries to heart muscles are blocked by plaque and clots, preventing blood flowing to the heart. Symptoms include commonly the shortness of breath, chest discomfort, tightness, and nausea. Heart continues beating, but muscles may slowly die from the lack of oxygen. Uh, Heart attack is a slow procedure. That means yes, it is slow to progress through symptoms over hours or even days. So in management, it has to have to call ambulance, has to give CPR as much as possible, fast, and it becomes unconscious, then has to stay into hospital. Management of cardiac arrest, you have to first call emergency number, have to has to ask for the emergency medical services, then start CPR within 90 seconds, and has to use automated external defibrillator if there is it is nearby, that is AED, use AED. And in case of heart attack, uh, the patient emergency number has to call, aspirin has to chew, patient is told to chew and swallow the aspirin, or patient has to take nitroglycerin, the tablets of nitroglycerin has to keep under the tongue. Both the patients should transfer to the hospital as soon as possible.